Discharge instructions for post-op patients. Discharge instructions give pertinent information for a patient to heal safely at home after a procedure. Providing adequate discharge instructions prevents readmission to the hospital for a patient. It is important for nurses to spend adequate time on these instructions for a patient to feel comfortable when heading home from the hospital. Make sure instructions are given to a patient when a family member or friend is present to make sure both parties know the instructions. Make sure instructions are easy to read and in the correct language for the patient. Pictures often make it easier for patients to recall instructions that are given in discharge instructions. Make sure you answer all the questions that the patient and family have and review any instructions if needed by the patient. In the next slides, I've included several important instructions that should be given to all post-op patients. Blood clots are always a risk after surgery. Signs of a blood clot would be pain or swelling in your calf muscle or a hard red area in your calf or thigh. Contact your doctor right away if you have any of these symptoms. In small cases, if a piece of a clot were to break off and travel to your lungs, it would be called a pulmonary embolism, or a PE, and this is a very serious condition. Signs of a PE are shortness of breath, not relieved with rest, or sudden chest pains that gets worse when you take deep breaths. If you have any of these symptoms, make sure you call 911 right away. Tips to help prevent blood clots are if you make sure you move around as soon as possible. If you're sitting for long periods of time, get up every hour or so and take a lap. You can also pump your ankles back and forth like you were driving a car to make sure you keep the blood flow directed to your heart. Drink plenty of fluids. Don't cross your legs or ankles while you sit, and don't smoke. Coughing and deep breathing exercises are very important to do after surgery to help keep your lungs clear of infection and help the anesthesia get out of your system a little bit quicker. Make sure you do these exercises every hour while you're awake. A patient may be given an incentive spirometer that they need to do 10 times each hour while awake. If they didn't get that tool, they can do coughing as well as deep breathing exercises. A good deep breathing exercise is to tell your patient to slowly take deep breaths in through their nose, hold it for 5 seconds, then out through their mouth. Constipation can be a problem after surgery. Anesthesia, as well as many narcotics, can be very constipating. Things to do to prevent this would be to keep moving. Walk when you can, which helps your bowels move regularly. Eating lots of fiber each day helps, and foods that contain a lot of fiber would it be fruits and vegetables, whole grain breads and cereals, and beans. And also drinking enough fluids helps as well. Tea and coffee often help some people. If you do need a stool softener, you can get that at the drugstore and take 1 to 2 each day. You can also find fiber bulking agents as well as a laxative if needed. Make sure you call your healthcare provider if you haven't had a bowel movement in 3 days or before using a suppository or an enema. Anesthesia can last in your system for 24 hours. Don't drive or operate heavy machinery for 24 hours. Don't drink alcohol for 24 hours. Don't make important decisions or sign important paperwork for 24 hours. and make sure you have a responsible adult that will stay with you overnight. You can include medication information in your discharge instructions. If a patient is getting a new prescription, this includes when they should take the medicine, how often, and if they should take it with food or not with food. They can also get this information from the pharmacy when they get their prescriptions filled. The surgeon will also add patient specific information to the instructions. These usually include dressing change information, when to resume medication, activity limitations, and follow up appointments. You can also include in your instructions the perimeters of when you should call the physician, such as a temperature, excessive bleeding, or foul smelling discharge from the incision site.